Hello everybody, welcome to the second half of today's event. This afternoon I'm sure it's going to be as informative as it was this morning on this beautiful day. I'm Roy Tapp, I am the coordinator for the Kentucky Safe Aging Coalition, and I'd like to take some of your lunch time, 10 minutes or so, and inform you about what the Safe Aging Coalition is and what we do. In a nutshell, we try to bridge various organizations and individuals with the educational side of fall prevention. And by that I mean we work with National Council on Aging. We're recognized by them. You'll see us mentioned on their website. We work with Lexington Senior Citizen Center. We work with various organizations concerning fall prevention, trying to get to the individual. And we do this in a matter of ways. One is literature distribution. For example, we have refrigeration magnets. You know, people like those things. Put it up on the refrigeration about how not to fall. We also have various lists, such as medication lists. How would they affect your vision, the medications you are taking, and therefore could also make you prone to fall-related matters. We also have home checklists where people can take these checklists. They come from various sources, just like there are other literature. They can be produced in-house, come from national sources, such as CDC or regional or state level organizations. And these home checklists will tell an individual what they can do to make it more safer in the house, for one. So that's one way we do it. We also do it in other ways too, such as an e-digest every month. For example, sir, you're on the mailing list, and you can be on the mailing list really easy. There's no registration, there are no credit card fees or anything like that. We just need your email address. So if you're interested in being on the Safe Aging Coalition e-digest, which comes out monthly, just send me an email or call the phone number on the handout for this meeting today. My email is rtapp2 at uky.edu. rtapp2 at uky.edu. The e-digest will have things such as what's going on. It will also mention funding sources, resources, and publications that one might be interested in. So that's another avenue we use. Further, we work with assistive devices. For example, going back to you, sir, if I may, you need a nightlight for your bathroom, or you need a walker, or you need a cane, or you need one of those bracelets that talk about blood thinners that you're on. We can help get those for you. There are sources for that. So therefore, if you cannot pay, or you choose not to, or you know somebody that needs these devices, we can assist in getting these for you. We also have quarterly meetings. Our next one is November 7th, and we have whoever wishes to join the meeting, join. And we go through what's happening. It's a build-up virtual Zoom meeting, and it's a build-up kind of in person with the e-digest of what's going on in that quarter. And get input from other people as well. Further, we have the annual summit, and we just had that in August. It's a yearly event. We will have guest speakers. This year, we had an attorney speak. Wonderful presentation. She brought two cases that she worked on, during the fall prevention and the outcome of that litigation in each case. And it was really something to see that aspect concerning fall prevention. We had a couple physicians. We had some other people as well. We tried to promote best practices throughout the tenure of our work. What's happening in the medical field, what's going on throughout the state. And one way we tried to make sure this is a statewide initiative is Fall Prevention Week. This year, it was September 16th through the 20th. And we had a document from Governor Bashir stating, proclamation, that that was Kentucky. So we have our website, we have our emails, we have our literatures, we got our e-digest. That's the stuff we do. We try to work with the individual as well as organizations throughout the state. 4 things I want to point out, if I may. New partnerships. In the last 6 months, we've made a lot of ground on this. For example, Samaritan Pete. Have you ever heard of Samaritan Pete International? Never heard of it? International organization. They are moving into Kentucky. They give away shoes. Children, older people, free shoes. And they're manufactured for this organization. They have sponsors like Coke, Pepsi, and other big national, international organizations. They are moving into this state, and they want to partner with us. They're big on fall provision. Because shoes, if you don't have the right shoes, wearing flip-flops or whatever, that's really hard. Other new partnerships, University of Kentucky with their trauma center. We have linked up with them, and we are getting data sources. What's happening in the emergency room? What's happening here? So these are the kind of things. Yes, ma'am. Oh, I'm sorry. I'm not loud enough anyway. I'm sorry. I'm used to walking around, so please forgive me. So these partnerships are allowing us to do many things, and speaking of data, we do have some in-house. And the young lady that just spoke, Ashley Bush, she is one of the people who have produced these documents, have collected this data, and made it available to people. So with these new partnerships, we are trying to arrange, just not locally, but statewide too. Down in the Somerset, Pulaski County area, a magazine, both print and online, called Communications, will be sponsoring us each month. The Messenger, which has over 18,000 subscribers in Kentucky, 3,700 basically in the Lexington area, will have an ad monthly about us as well. So we are trying to get the word out the best we can with these partnerships. We're working with radio stations, trying to get on-air time as well. So we're trying to take every avenue we can. So these reaching out initiatives are really paying off in some ways. We're getting phone calls from individuals. Can you help me? Or the organization will say, can you come and speak to this event? So we know it's working. But there's one area where I wish it would work better, and that is hearing from you. This gentleman, for example, and this lady, for example, you have your own fall prevention organization event, say out in Western Kentucky. Nobody knows what you're doing really. So can we have like a shout out page on the website, or can we mention you in their e-digest or the annual conference? This is what these people are doing. It's that good. Can we do that? So it's a two-way street, so that's what we're trying to do here. Build the coalitions, build the partnerships, get these initiatives out and not stop. A couple more initiatives for the first, to show you with the first 2 items. Homebound 65 years old adults and older. How did we come up with this? A few days ago, I was in a park with my dog, and I ran across this guy with a walker, older individual, and in their discussions, I found out that he was homebound. He could only get out once or twice a month. Could not drive or anything else, had to be dependent on his daughter to get him, the doctor's appointments or whatever. Well, he wasn't the first person I ran into in the last few months. There was others. And talking with them and so on, I asked them what's contact you get and so on. And it kept saying Meals on Wheels. So with Meals on Wheels, we have partnered in the Lexington area and looking at other areas as well to distribute information and assisted devices, and it's working. We started out with 160 individuals at first. Next week, Meals on Wheels in Lexington wants 20 more packages of information. They have newcomers. Yes, it's a transit situation. So therefore, we're able to work with Meals on Wheels and with, sir, for example, I know the microphone. Meals on Wheels, and you're homebound and so on, we can get your literature. You got a phone number or somebody to call me or email me if you have a relative that can email, or maybe you can, and we can help you out. You're not so isolated, therefore. We also found out that the Senior Citizen Center for Lexington does a food program as well. Not as big as Meals on Wheels. We partnered with them to reach another group of individuals who are homebound with literature and information. And we're looking at expanding. These initiatives and reaching out and working with older individuals can be interesting. I'm from Eastern Kentucky. You go in McGoffin County, Floyd County, and so on, forget about putting stuff in the local library like we have in Georgetown and other areas for older people to have access to. It's not the library they go to, it is the historical society building they go to because of family relationships. They're always wanting to know what we do about our families, and that's a big thing in those counties. So using those kinds of avenues, we can get a hold of individuals in various ways and promote the mission of the Safe Aging Coalition in regards to fall prevention. As you can tell, I'm passionate about this stuff. And why? Story, true story, the street of Wilson. Up the street, had an uncle, career Marine, city manager, Dayton, great life, 89 years old. In their house, they had a spiral staircase. It was an A-frame, and they had the spiral staircase. Not the ideal kind of building one would think you would live in, correct, at that age. He fell down too many times down the stairs, last time killed him. Next door to where I grew up, longtime friend, living by himself, divorced, children out of state. Oldest child lived in Las Vegas, so there wasn't much interaction with family. Son was in on vacation, thought he'd go check on his dad. His father had been laying on the living room floor for 14 hours. Had no device, no methodology of calling anybody. Didn't have a cell phone or anything like that. The house I lived in, a certain individual kept falling, hurting themselves, and wound up in the emergency room where she had peeled up the skin up her arm by hitting the coffee table. So what's my point here? This stuff happens to all of us at some point. We all fall, especially when you get older. And something I have noticed in the webinars and other things I've attended in the last month or so, there's a movement from a physician or caregiver saying, do you feel safe at home? The question is about fall prevention. Are you falling at home? Because it's such a big issue. Now, how big of an issue it is, that brings us to our next item. Safe Steps for Veterans Act. The official name of this, and I know you're going to write it down. I know you're going to write down all these fancy words. Supporting access to falls education and prevention, and strengthening training efforts and promoting safety initiatives for Veterans Act of 2024. What a mouthful. Or you can use the alternate title of the bill. What this bill does, it was introduced, and there's actually more than one fall prevention bill introduced in Congress this year. What it does is tell all the VA centers that they must screen every veteran that comes in there for fall prevention. And they want the PTs to do that, the physical therapists. Of course, there's a resource issue involved. Do they have enough PTs to do this? So they may have to hire some people and so on. And the basis for this is because you go to any VA center, including ones in Lexington, Leestown, and Cooper Drive, falling is the #1 reason why they're in the emergency room, just like any place else in most cases. And it's a big strain on them. They have enough to do with other unique medical situations. So not only is there local movements, such as with Kentucky Safe Aging Coalition, but now there's a national movement through Congress to start addressing this healthcare issue as well. Test question. You didn't think this was going to happen today, did you? I'm a former teacher. Staircase at somebody's house. Notice anything different? I'm sorry? No? There are actually correct steps. With what? The height. Okay, yes? Yes, ma'am. This is in the house too. On the staircase inside the house. Stairs go like this. You got a little landing and goes like this downstairs. Why? There's a movement in this country with eye doctors. We call them seeing dogs back home. Dealing with other people's eyesight and having trouble picking out next stairs when they're the same color. So the ideal is put a band of color or something there so they know, the older people know, there's another step coming. The person that this house belonged to fell multiple times, inside and out. No more falls since February. Maybe there's something to it. Simple review. I don't know how you would do this with carpet on stairs, paint or tape, but you can do it with towel, wood, and so on. And this is the kind of information we want to get out. The simple things, doesn't cost much, something that the homeowner may be able to do him or herself and make a difference in their lives. So in summary, my time's about up. This is what we do at the Kentucky Safe Aging Coalition. We are doing our best to help people out. It's not something that's going to be solved. We're not going to just have no falls in this country at all. It's not going to happen. But the point is, maybe we can make them less severe, and if we can get them canes, rollers, or walkers, or even walking sticks that are now being promoted, for example, through the New York hospital system for older people instead of the cane, because a cane is perceived as not a good device for fall prevention anymore because of the way you grip it and how it hits the ground. If we can get these items, this knowledge out to individuals and to other organizations, share it, be a promoter of best practice, literature or whatever, then we're doing all right. Yes, ma'am.
You don't collaborate with the local UMS?
Somewhat, yes.
And they're starting this initiative of I didn't want to college program. And so they have instituted a new program community programs that community person looking at collaboration with our health department. I didn't know he was asking me for resources, so I didn't know if that's.
Did you email me by chance? Somebody emailed me from Jessamine County, and I did respond.
No, it wasn't me.
Okay.
But our officer had.
Yes, I have a.
I'm making sure that
Yes, ma'am. I have a tad experience. I've talked to firefighters and other EMS personnel. Not as much as I want to. It's just not enough hours, it seems like, to do everything you want to do, if you know what I mean. And but we're going to keep at it. One thing I know is in the Washington Post, the newspaper a few months ago, there was a big article about how more and more individuals, just not the nursing home organizations, so on, are calling EMS, help these people out and take them to appointments. some individuals that are over 65 are in such bad shape physically, they need somebody besides your walker to help them get to the vehicle to go point. And why? Liability issues. If I'm a nursing home operator, why not have the local government, EMS folks, take care of that task for me and perhaps lessen my liability? Remember talking about our annual summit back in August, and the first presentation was by the attorney with the 2 cases and the litigation, and these were big awards that she was able to get for her clients. And they were kind of interesting, plus a little disturbing for a lot of people, but it's what goes on. Now, going back to the individual, and I'm going to wrap this up with this, going back to the individual I was talking about earlier in the park. What drew me to him was his hat, his shirt, and this picture on his walker. And his walker, he also had a cane strapped to it too. And we just started talking like people do. His hat was one of those MAGA hats. M-A-G-A, make Andy Griffith again. He was homebound, remember? That was his world. He couldn't afford cable TV and so on, so he got whatever channels he could. His shirt had the cast of Andy Griffith on it. The boy, the barber, and so on. And then the picture on his walker had Aunt Bee. That was his world. He's isolated to that. And even in this day and age, 21st century, with cell phones and tablets, which anybody can use and do, people over 65 do, we still have so many that are isolated and they don't want to ask for help because of pride, or they think they can't afford it. Thank you for listening to me. I appreciate it. Hopefully I didn't disturb your lunch too much. But as you can see, this is a big issue, and there's so many people doing good work with it. Have a good day.